As a parent of a child with special needs, maybe the first line of treatment that's been recommended by a medical doctor would be a pharmacological treatment. It would be a over-the-counter or prescriptive medication, and sometimes that's very appropriate. But I also know that parents don't want that first line to be a pill. So what if music can serve as a replacement for that pill? Now, I'm not talking about a magic pill or a magic bullet. Music doesn't work that way. However, the research is becoming increasingly and increasingly stronger, showing us that specific music used in different ways can have very specific therapeutic effects. And more research is being done actually looking at even combinations of music and drug delivery in some cases. And in fact, there's one research study that I'll talk about. It was recently published in Frontiers of Neuroscience. And that's where they took music of Mozart, very similar to the music within the listening program, and played that to rats who had two different types of pain. And then they paired that with ibuprofen, with CBD oil, and with two other pain medications to actually see, was the music more effective or was the pain medicine more effective, and actually found certain combinations of the music and the pill were more effective than the pill alone. So the fact that music could enhance the delivery of a prescription medication is incredibly powerful, and it tells us about the benefits as a standalone. And what's the true benefit of using music in place of a therapeutic pill? The benefits of the music is there are no side effects. It feels good to listen to. It's very accessible, it's available on demand, and you can't overdose. I want to be very clear that the listening program is not a replacement for your doctor's recommendations. What I do want to say is that some medical doctors are actually trained as listening program providers and use this as part of their medical practice, as well as other healthcare practitioners. Those that are conscious that drugs are not always the answer, and if we can find a natural holistic alternative, and what better alternative than music, then why not try that first? Then if there's a need for the medication, then of course that comes in and is used appropriately as needed. So here's a suggestion. If you're working with a therapist or with a doctor and they're not trained as a provider of the listening program, show them the website, provide them information, have them call us, we'll educate them, we'll train them, then they can incorporate this as part of their practice. And in fact, majority of the providers that we train have become providers because they've seen clients in their practice that were doing the listening program. They were seeing what was happening, asking the parents, what are you doing? Johnny's changed, and I'm not accustomed to seeing this kind of change. What new have you added in outside of our regime? And often that answer is the listening program. So we have seen just this grow organically over 20 years. The majority of practitioners that we're training are coming because colleagues are getting results or families are coming to them and demonstrating that they've been getting a benefit from the music.